Great, thanks very much, Gulu. Before we get started, I actually want to ask if everyone, this is a big room and the sound, it's a little bit difficult. Could everybody sort of scoot forward just a little bit? To make sure that I can hear you and you can hear me. Okay, great. Thank you very much. So first, I just want to thank the organizers for the invitation and the opportunity to be here, especially Gulu, who has been instrumental in helping to organize this session and invited me a few months ago. When I first received her invitation, I was really delighted to be able to come here and join all of you, because of course you are the future leaders who will be hopefully changing and affecting and improving some of the global governance problems that that I'm about to introduce to you. And some of this material might be quite new for you, but my intention and my motivation in coming here is to plant some seeds of interest in your brains in the hopes that we can work towards a better world that works better for health in the next 10, 20, 30, or 50 years. So before I jump in, I would love to hear just very briefly where everybody is from, to get a sense and I can sort of figure out a little bit better how to pitch this presentation. So if you could just quickly go around the room and say your name and which country you're coming from, that would be a huge help for me. So let me start right here.
My name is Nune and I'm from Denmark.
Yeah, and my name is Sandra. I'm also from Denmark. Sophie, Denmark.
Matthew, Denmark.
Me? I'm Camilla from Sweden.
Cecilia from Norway.
And Chen Ye from Taiwan.
Oh, Reshma from USA.
Khrushchev from the Netherlands.
I'm Alessandra from Switzerland.
Joanna from Norway.
Luan from Ethiopia.
Luca from Malta.
Kelly from Malta.
Randy from the Philippines.
Quebec.
One from Norway.
Anna from Denmark. Julie from Norway. Sophie from Norway.
Safira from the Netherlands.
Karen from Kenya.
Catherine from Quebec, Canada.
Gogo from Kenya.
Claire from the Netherlands. Araya from the Netherlands.
Belle from Taiwan.
Rachel from the Netherlands. Danica from the Netherlands.
Pao from Taiwan.
Ruth from Ethiopia.
Amy from Taiwan. Yachu from China. Emily from Taiwan. Nana from Denmark. Isaac from Denmark.
Maria from Tanzania.
Okay, wonderful. Thank you all for being here. I know it's a little bit early to start for medical students. So let me just say a few words about the topic and the way that we're going to organize the next we'll be spending together. I understand that you've had some background already over the last couple of days on, of course, global health and on the social determinants and on some basic issues that I'm not going to spend much time on. But what I will cover is actually this notion of global governance. What is global governance? What does it have to do with health? And how can we start to think about and unpack this notion of global governance for health, which I think is relatively new in the public health field and relatively new for those of us who've been working on global governance as an academic field over the last 10 or 20 years. So we'll spend the first hour on that. I'm going to do mostly lecture with time for Q&A. I'll take some breaks for Q&A, and please feel free to engage, because I know some of the terminology can be new or abstract, particularly in the public health field. And then the second hour we're going to spend on a case study. And I know some of you have received the case study by email on access to pandemic flu vaccine. Can I just get a quick show of hands to read the case study? Okay. And I understand that we did a sort of last minute combining of groups, so that's fine. We'll try to mix up the groups because at some point I'll present the material in the case study briefly, so those of you who haven't had a chance to read it will get up to speed, and then break up into small groups for discussion and then come back together where you can try to apply some of the key concepts that Okay, so let me just without any further ado, and in any case, this is the overview of my presentation. Thank you. Okay. So I think it's impossible to talk about global governance without first spending a few minutes talking about globalization and major trends in globalization. Then we'll move into some ideas about what global governance is. What does this term actually refer to? What are some key challenges in global governance? Why is it that global governance is oftentimes more difficult, for example, than national governance, even if it can have profound impacts on health? And then, as I mentioned before, move into our case study in the second hour. Okay, so let's begin with globalization. So who can give me a quick idea of what is globalization? We're all living in an era of globalization. This is not going to be new, I think, for most of you. What are some key features of globalization? There's a clue up on the slide. Okay, more or less what I'm referring to is what we call the increased intensity of the cross-border movement of people, whether or involuntary migrants, goods, primarily through globalized trade and production networks, ideas, and ideas can be ideas about democracy, they can be ideas about public health practices, they can be ideas about lifestyles, such as sedentary lifestyles versus more active lifestyles, they can be all sorts of different types of things. Resources, and by resources I'm talking about financial resources as well as other types of normative resources, for example. Once you get cross-border movement of people, goods, ideas, and resources, you also, of course, accelerate cross-border movement of microbes and oftentimes of other types of health threats. And there are new types of health threats that have come up with globalization. And these health threats are threats that we often have difficulty responding to at the nation state level. So this is why I'm thinking first about what has changed over the last 50 years. What does globalization actually imply for protecting public health, either within the nation state or beyond the nation state? This is the key point from which we should begin. One of the implications of globalization is, of course, this notion of interconnectedness. And by interconnectedness, I'm talking about the nature of the threats that societies face as well as the effects of those societies. So what I'm talking about is, for example, if here in the United States, in Texas, we have a factory that is spewing pollutants into the atmosphere, and those pollutants cross the border into Mexico. There's an interconnection there, right? Mexico has negative consequences taken in the U.S. And you see these types of relationships all over the world. This is what we mean by the notion of interconnectedness. I think much more important, actually, though, for global governance is this notion of interdependence, which is not only talking about the fact that societies are connected across borders, which I think is nothing new to a group like you, who clearly are a living, breathing example of the connectedness of societies across borders, but this notion that, in fact, we depend on each other, that societies in different states depend on each other to respond to some of these health threats. So interdependence as a term refers to not only sharing common health threats, but the notion of who has the power, the capacity, and therefore the responsibility to respond to some of these health threats. And what we find more and more is that it becomes difficult for any one nation state to respond effectively to the health threats that affect its own population. People who've been living in smaller countries or countries that are very close to each other, for them, this is not a new idea. In the most powerful countries in the world, The notion that the United States government, for example, can no longer adequately protect the health of its own population without engaging and collaborating with other governments is increasingly becoming accepted. So this is the notion of interdependence. I just want to say as a brief side note that globalization is, of course, not a new process. We can trace globalization processes as far back as 500 years ago, as more and more trade and travel started to tie societies more closely together. But what most people would agree on is that in the last 20 years in particular, there's been of these cross-border ties. And this is what the motivation to develop stronger forms of global governance comes from. The notion is that because of this new interconnection and interdependence, we need to find better, more effective, more predictable ways of actually working together across nation states to respond to these threats. That's really at the heart of global governance. So talking about globalization, oftentimes, especially in the mainstream media, when you hear the term globalization, people are referring to economic globalization. They talk about the globalization of trade, and they talk about the globalization, for example, of production and supply chains, for example, and the movement of money across the globe. The globalization of the international financial system, for example, was partly responsible for the fact that the financial crisis in 2008 quickly had world effects. It was not just isolated to one country where it began. But globalization, of course, as I mentioned in the previous slide, does not only have to do with economic issues, but in fact a whole set of issue areas. And I'm just going to go quickly down a few here. First, in the area of peace and security, considered to be fundamentally the most important responsibility of a state is guaranteeing the peace and security of a population within its borders. A challenge to the ability of nation states, of course, to do that, as well as new institutions to try to keep peace across borders. And by new, I think for many of you, when I say new, you might be thinking my whole life. I've heard about these institutions such as peacekeeping, terrorist networks, the global arms trade. When I say new, I'm actually referring to developments over the last 20 years. So for you, it may not be new, and it's in fact everything that you're familiar with. But when you think about where the institutions of global governance come from, it's still a relatively new development. That at the international level, we're still relying on institutions built about 60 years ago, and they're still in fact trying to catch up to this new type of world that we live in. And this gets to some of the challenges that I'll get to in the second part of my presentation. So we have peace and security. A second area, of course, is economic and financial. And I just mentioned intense relationships. Third is social and cultural. And again, I don't think I need to remind anybody in this room that the traditional media is increasingly being challenged by new forms, particularly of social media, that there are new connections across people from different countries, whether it's people in the room or the people that you're in touch with once you leave this room, and the networks that you build. Of course, increased migration and travel. I cannot imagine that 20 years ago it would have been possible for medical students from around the world to convene regularly. 100 plus countries being represented twice a year. The decreasing cost of travel has made the building of these networks possible. So increased social interconnectedness that was unimaginable even just 20 years ago. And of course, networks of civil society and sometimes what's called uncivil society. Does anybody know what uncivil society might refer to? This phrase? Take a guess. In the front row? Yes.
Paris, but I was thinking countries that aren't as developed as
Sorry, and
unindustrial countries, developing countries.
No, well, I think generally the notion of uncivil society as it's used in sociology and in political science is referring to social networks across borders that often have harmful effects on society. So terrorist networks might fall into that category, organized crime, human trafficking networks. I mean, these are also often interconnected. And the reason why people have come up with this category of uncivil society is because the notion of civil society, the idea that people are connected across borders in more and more dense networks, is usually pointed to as a good thing. Like, this is good for society, for people to be able to communicate easily across borders. And others have argued that actually, in many ways it's good, yes, but in other ways it can actually pose new challenges for society. For example, through criminal networks. Okay, a couple other areas. Environment, of course, climate change is a big issue that now affects everyone across the globe. Certainly no one country is able to respond on its own to climate change. The rapid movement of air and water pollution across borders, the impact of global production networks, the fact that pollutants as a result move again to another, as well as the response to some of these challenges, such as transnational activist groups like Greenpeace, who try to, in fact, work across borders to better respond to environmental challenges. And then finally, probably the topic that most of you are most interested in, which is health. And when it comes to health, and we think about what are the challenges that are linked to globalization, pandemics are one that easily comes to mind. The fact that epidemics will move faster because of air travel, for example. But as I mentioned before, also the spread of lifestyles, sedentary lifestyles that can contribute to non-communicable diseases, the spread of smoking, which has seen a major increase over the last 2 decades as the tobacco industry has globalized. Health-related practices, such as the use of oral hydration salts or hand washing. These are all processes of globalization, and of course the various other threats and opportunities that arise, which we'll go into in just a minute. So when we start to think about globalization and its relationship to global health, I think it's important to think across 3 areas, both the globalization of risks and threats, and the globalization of opportunities and responses to those threats, and finally, the globalization of governance. And by that, I mean the construction or the way that societies, in fact, work together to respond to global risks and threats. So what is one of the key features of the globalization of governance? In terms of the structure of global governance, one of the key features is a shift away from pure state-based approaches to new institutions to manage problems in the global public domain. And Oliver, wondering, what does that mean? What is she talking about? So can anybody tell me what is a main way in which countries work together today at the international level to address common problems? Structure, yeah.
Intergovernmental organizations.
Intergovernmental organizations such as? United Nations system, right, exactly. This is really probably the central formal structure of global governance. And when we start to analyze what is wrong or weak or insufficient about current global governance processes, the place to begin is really looking at the UN system and how does the UN system either fail or fall short in actually helping societies to address shared problems. So when was the UN system first created, and what was the rationale for its creation? Anybody know? Was it created 10 years ago? Years ago?
After World War II. And it was in response to seeing that was kind of, those world wars where they noticed there was be increasing cross-border threats and coalitions of countries coming together. So they wanted to set kind of a universal system for managing those threats, and also having a forum where countries, groups or by themselves, could approach a large body to make decisions about other countries that they might be interacting with.
That's right. It's exactly to do that, to try to manage the new relationships of interdependence that followed from what some people would call the first era of globalization, which was from the end of the 1900s, the end of the 1800s through about the end of World War II, so the middle of the 20th century. Of the upheavals of the Second World War, the United Nations was created as a way to bring countries together to debate, to dialogue, to try to identify ways of solving common problems. Of course, it has not always worked that perfectly in practice, but that was really the intention in a nutshell. Now, one of the key principles that formed a building block of the United Nations was the notion that the nation state, or the government of a country, was the primary actor responsible for the well-being of its people beyond the nation state level. So what that meant was that I'm a US citizen, the US government is primarily responsible for representing my interests once debates move to the international, transnational, or global level. And that was really the only way in which my interests could be represented at the global level. I really have to go through my national government. And true for, of course, all, I think we're now at about 200 nation states within the UN system. So the big shift in the reason why we need this rather than the older notion of international relations is that, in fact, we no longer rely so heavily on governments as the only ways in which we can express our interests, have debates, dialogues, solve problems, et cetera, at the transnational level. And this has lots of implications for how effective, in fact, the UN system is, how effective we are at responding to certain problems. So in terms of the structure of global governance, this is what I mean by the shift away from pure state-based approaches to new institutions to manage problems. And in terms of actors, it used to be that governments were really the only major actors. Maybe one or two big transnational companies, but primarily governments held most of the power, the money, the influence, and decision-making authority at the international level. Today we know that this is no longer the case. We have all sorts of new actors that are important in global governance. These include, of course, firms. Multinational firms is one example. CSOs, by which I'm referring to civil society organizations, civil or uncivil. Experts. Oftentimes people don't think that experts can actually have a role in shaping the way global decisions are made, but what we see is that as information becomes more and more important, experts actually can have a huge impact in shaping the way people think about a problem and shaping the way people respond to a problem, very closely related to and individuals, citizens such as yourselves, individuals who have moral authority, for example, leaders who might be looked up to by a broad part of the global population, and I also always like to use Nelson Mandela as an example. People like him can have, as an individual, a huge impact actually on global governance processes. And 20 years ago, nobody thought this way. They thought everything rests in the hands of governments. Okay, so that's just a brief introduction to globalization. Let's switch gears a little bit and dig deeper into this notion of governance. What is governance and why does it matter? So here's one definition of global governance. And I think the key feature to understand about global governance is that we are not talking about a global government. What might be the difference between governance and government? And I know that for many of you, you're not English speakers, so I'll slow down a bit. But the distinction might not be totally obvious. So let's spend a couple minutes talking about the difference between government and governance. Any ideas what the difference might be? Yes?
I'm not a native English speaker, so I'm really not sure about it, but I see governance as something you have to agree and work on, where a government is where you choose people that have the mandate to choose the position, the opinion of several countries. I don't know if it's the correct distinction.
So I think you raised a couple of great points there. You're talking about a government as being more formal and structured, which is yes, often the case. Often operating at the national level. We think about national government. Sometimes we might think about city governments, but it's a formal sort of decision-making process or structure to manage the affairs of society. And governance, does anybody want to add to what the distinction might be?
I feel for governments there's less of a, it's more of a horizontal program where
every party has the same level of the same status?
Oftentimes, this is a key feature of global governance in particular, right? That there is no such thing as a world government. There is not a authority that has hierarchical power, as you said, that is able to, in fact, enforce compliance or to dictate what different actors do, which is very, very different from what happens at the national level. So when I use the term governance, we're talking about a processes by which societies are actually managing their affairs, rather than the structure of government itself. There can be structures at the global level that contribute, but governance is a broader concept than government. So if I talked about what is the governance of this particular seminar, we don't have to have necessarily a structure of government, but we know that there is an organizer, there is a lead presenter, there will be a set of processes by which we hopefully get to the end of the seminar and you've learned something that's interesting for you. It's a much broader concept than the formal structures of government. Why is this important at the global level? It's precisely what Catherine was saying. Because we don't have a world government, when we think about how issues get managed at the global level, things are much messier. And certain challenges arise that are much more difficult to resolve at global versus national level. So here is a pretty academic definition, and I'll go through it and then present, I think, a more intuitive definition. So the academic definition is that global governance is a complex of formal and informal institutions, mechanisms, relationships, and processes between and among states. As we mentioned, of course, states still matter, governments still matter, markets, citizens, and organizations, both inter and non-governmental, through which collective interests on the global plane are articulated, rights and obligations established, and differences are mediated. I think this is a nice definition. It's very thorough. It covers a lot of different areas, but it can be a little bit what really does that mean. So I think a more intuitive way and a shorter way of thinking about what is global governance is to think of it as the way in which the world organizes and collectively manages issues with global significance. So some examples of those issues are financial stability, environmental sustainability, peace and security, or what I think many of you are interested in, which is global public health. How do we organize ourselves at the global level to try to improve global public health? As I was saying before, at the level, governance processes taking place within the state, as well as a clear hierarchy and power and authority that sits at the national level. So, for example, if I leave this hotel and I commit a crime, let's say I speed, I'm driving in a car and I'm speeding and I accidentally hit somebody. There is an authority, there's a police force, I will be arrested, I will be judged, I will be put on trial, and a whole system in place to accountability for that rules are enforced, and that there is an ultimate authority that is responsible for this type of thing. If I do something equivalent at the transnational level, not as an individual but as a country, there is no similar hierarchical authority, right? If one country does the equivalent of accidentally harming, or in some cases severely harming citizens of another country, there is no global power that can in fact arrest, judge, jail, or punish, in fact, the country that has perhaps perpetrated some type of crime against another country. We have very, very weak institutions at the global level to manage similar types of problems. So one of the conclusions that scholars of relations have come to is that because of this absence of a hierarchical authority at the global level, what this means is that we might find ourselves in a situation of anarchy, domination, in which cooperation between states is impossible. When there is no president, police force, justice system, etc., then we may end up in a world that is in fact a terrible world to live in. We get to the notion beyond the international level, as I said, which is really focusing on states, and we move to this notion of global governance with multiple actors. Some of the same questions come up. who has power, who has authority, who can enforce agreements or rules between nation states, but not only nation states, also starting to look at non-state actors. And by non-state, I'm referring to corporations, civil society groups, academic experts, journalists, et cetera, et cetera. If a journalist, for example, publishes something that is completely wrong and it goes viral on the internet, who is the global authority that can hold that journalist accountable? Is there any such global authority? This is a question for you all to think about. So some of the questions that begin to come up when we move from thinking about international relations to not only authority, which is so important, but we also start to think about the legitimacy of various actors. Who should have control or power or influence in a world where you don't have democratically elected representatives in a government? The journalist I'm referring to is not necessarily going to be governed by the same forces at global level as at national level. And what the other factor that we see is that the world becomes much more complex, right? So it's no longer 193 nation states who are the main players. We are in fact starting to think about thousands and thousands of different actors who are interacting and shaping the way an issue is managed at the global level. Okay, I think I'm going to skip this slide actually. So just to illustrate for you what is this complexity actually. When we think about this is a classic model of how international agreements are constructed. Can anybody give me an example of an international agreement that's relevant for health? A treaty, let's say. Yes.
The Tobacco Framework Convention.
Right, so the Framework Convention on Tobacco Control, that's a great example. That was the first treaty negotiated within the auspices of the World Health Organization, and it is one of the most prominent agreements that have to do with health. That's a great, let's take that as an example. So under the classic view of the world, the way the Framework Convention, the FCTC, as it's called, was negotiated was within one country. Let's take this country and say it's Denmark, because we have a significant Danish contingent here. And this country here can be a Kenyan contingent, and this country here can be the Philippines. The idea under classic international relations theory is that within Denmark, you have different groups with different views on tobacco control. They get together, they fight amongst themselves, and then they figure out what is our common position as Denmark on global tobacco control. And the same thing happens in other countries. Then the governments come together in Geneva, and they negotiate with each other based on what each government's position is. With an international. That's the classic idea behind how international agreements come into being, how rules at the global level are established. But when we look at the reality, actually, for example, the way the Framework Convention on Tobacco Control was negotiated, that's not actually what happened. That's not actually the way the world works. What we saw was that, for example, let's say this organization here, B3, is a anti-smoking campaigning group, a civil society group that is working to reduce smoking within Denmark. They would network with the same group in Kenya and the same group in, they say the Philippines? Yes. To develop strategies. What can we do when negotiations take place in Geneva to actually try to get a better text for ourselves? So you have networks of groups. You might have a transnational corporation, the tobacco industry. You can bet they were working very closely with each other to, in fact, try to shape and weaken or even block the negotiation of the treaty. And some would argue they were quite successful in weakening certain provisions included in the Framework Convention. You also have, of course, IGO, that stands for Intergovernmental Organization. In this case, the played a very important role, but that was not the only one. You had the World Trade Organization that was an important stakeholder. I'm not so sure on Framework Convention which other IGOs were involved, but at least two. And their secretariats are also often interacting not only with each other, but with the industry, with civil society, etc. And then, of course, you still have governments. Governments still matter. But you can see that they're permeable in a way, that it doesn't make sense to government as government. If we look at this picture compared with this picture, what we see is that the world is much more complex, which is perhaps not such a stunning revelation. But what we also see, and what's interesting about this picture, is that the ways in which people can influence and shape what finally gets into that agreement are almost infinite. And in some ways that can be good. It can open up new possibilities and opportunities for students like yourselves, for example, to influence these processes organized as medical students. So for example, on access to medicines issues, the student group, the Universities Allied for Essential Medicines, has played an important role participating with other groups in such types of negotiations, as together with intergovernmental organizations, with governments, working side by side with a number of other actors to shape negotiations at global level relevant for access to medicines. So this is, the complexity is there, and it's very difficult for people to predict how will a certain negotiation finish. I think for me the good news is that the new world of global governance opens up lots of opportunities for activism and for influence. Let me go back for just a second to basic international relations theory at this point. So why do I say that today it's more difficult to predict the outcome than perhaps 50 years ago? Or does anybody?
The outcome of what?
Have an idea? Sorry?
The outcome of what exactly?
Yeah, the outcome. So our theories about whose interests will dominate at the global level used to be quite basic, because they said if one major structure of international relations, and the notion of realism was the most powerful state will always win. I mean, that's it in a nutshell. So I'll skip some of these boxes. But basically, what really mattered for shaping the outcome of global affairs was military power and economic power. If you have guns and money, then your interest will dominate at the end of the day. And I think there's a lot of evidence in world history that oftentimes there is a lot of what we call realism in the world, of course. But then there are two other theories that I think are also important to keep in mind. Again, when you're trying to predict what is the outcome of this negotiation going to be. Now, the second is called liberal institutionalism, and it puts a lot of emphasis on economic power, but also on the possibility that countries will have shared interests, can come together and reach agreements. And one country is not always trying to bind together, which is the liberalism. So liberalism predicts that institutions like the UN can make a difference. That treaties like the Framework Convention on Tobacco Control can make a difference by bringing certain states together and helping them to achieve their shared goals. And then there's a third major strand, usually referred to as constructivism. And constructivists will usually say, we agree, military power matters, economic power matters, international institutions, so the formal rules of the game matter. But the other thing that matters are norms, ideas. What is the right way in which human beings should behave? What is the right way in which countries should behave? The way in which issues are framed. And this is this is probably the most controversial strand, but I think what we see in the field of global health is that ideas matter a whole lot. Anybody give me an example of a big idea in global health from the last, I'll give you a clue, from the last 13 years? That's a big idea. I'm going to try to get somebody in the back of the room to offer. Yes? Are you stretching?
Yeah.
Okay. Give me a big idea. What's a big idea in global health?
No, I'm just...
Okay, yes, go ahead.
The Millennium Development Goals.
Thank you. Perfect. The Millennium Development Goals. Right? These are an idea. They're an idea about 13 years ago, in the year 2000. And it was an idea that, in fact, out of the 8 Millennium Development Goals, or the MDGs, as they're called, 3.5, arguably 4, have direct relevance for health. And the idea is that certain individuals, children, women, or people living in poverty. In fact, there's a universal obligation or responsibility to reduce malnutrition, for example, reduce rates of malaria, HIV, and TB. The idea is that we're very formal in the year 2000. And if we look from the perspective of today and we look back at what has been the impact of the MDGs, we see that the MDGs have driven literally billions of dollars in international spending on health, and it has helped to put health on a much higher profile in international affairs. This is just one example of the power of ideas and the ways in which they can actually shape what happens at the global level. So the reason I covered this, and this is also, by the way, those of you who have a background in international relations will know this is really a cartoon version, a highly simplified version. But the idea is that it's more and more difficult to predict. We used to be able to say country B is more militarily or economically powerful than A or C. Country B's interest will win out in the international agreement. That was the prediction. And today we see that it's not just traditional forms of power that matter, but again, there are many different ways of influence. Primarily, that's a positive message. I think that's generally a good development in global affairs. So let me pause here for just a minute to see if there are any questions or comments for clarification. I know I've begun in a very sort of general and abstract way. We'll get much more concrete when we get to the case study, but let me just pause for a minute. Okay. Yes?
Well, one of the interesting points is that even though those three circles look maybe the same size, but maybe oftentimes in a real-life situation, some of the countries within this governance will be very powerful, and even some other countries, their circle might be very small, or not even be staying in the governance. So this is something very tricky. But even do you think in this governance will be into a more like government, like a global government with authority? Because so far, even we have a lot of statements about health, about global issues, but a lot of times there are no punishment for countries that violate the rules. So that's the thing I'd like to talk about.
Sure. Yeah, that's an excellent question, and often both the first question that comes up in the class that we teach, as well as the last question that comes up. Are we moving towards a world government or a global government? Because some of the problems that we face are so difficult, as you were saying, enforcement of rules. If a country violates the ban on nuclear weapons, for example, that it signed on to, what can you do? There's not a whole lot. Right? There's no police force. And because the negative effects for society can be so profound, do we not need to move toward a global government? I think that's the heart of your question, yes?
Yeah.
Okay. Let's see. How do I respond? Let me offer, and then I will actually come back to this at the end of the session. One, do I think it's likely in your lifetimes, I won't talk about my lifetime, but your lifetimes, that we will see a global government that works like a national government? No. I actually don't think so. I think what we're going to see is a proliferation of nation states who, in fact, want to keep more control at the national level and don't want to see control to something like a global government. And if we think about countries, is anybody here from Sudan? South Sudan? East Timor? Okay. Kosovo? What we see is a move, in fact, in many countries towards subnationalism, wanting, in fact, so whether or not that happens is, of course, a very difficult political question, but there are plenty of subnational groups that want more autonomy, and we have seen, in fact, the creation of new nation states, particularly over the last 60 years. I think that's an important trend. But what I think we will see is more and more dense arrangements for global governance, sets of rules, systems that try to get as much enforcement or compliance as possible within of the system of sovereign nation states that we have. Yes?
Just like following up from that, so global citizenship is probably very far away in the future, maybe not even listing. But what would you comment on, for instance, if you look at the European Union as a concrete example? Because I don't think that 50 years ago you would have expected that you would have a union of 27 nations that have a centralized system. And I think that's possible in other parts of the world as well, with regionalization rather than globalization.
Yeah, regionalization. That's a great question. The European Union is an excellent example of something unimaginable before, and I think that has been credited, as the Nobel Peace Prize Committee declared last December, has been credited with maintaining peace in Europe, particularly over the last several decades. So I think there is room for lots of creative new types of arrangements that might operate more on the regional level. Absolutely, I think that's a great point. Of course, what we're also seeing today is how difficult it is to maintain even the few powers that nation states have delegated to the European Union. And they're not insignificant powers, but recall that the 27 member states still retain quite a bit of sovereignty and policy space on a number of key issues. It's still not the same as a nation state in a number of different respects. I do think it's a fascinating experiment in governance, actually, and we're seeing the strains with the financial crisis to that system, but it hasn't broken, and I think that's very significant. Yeah, Yevgeny.
Just some reflection on a question. Because you said you think we might go towards stronger kind of clusters of governance institutions in the future. And I'm kind of thinking, when you look at the governance system today, you see a power difference within governance arrangements according to what kind of interests they are protecting. And if we go towards some of these clusters being stronger than other, and kind of due to also the sovereignty challenge that some strong countries tend to protect some interests more than others, do you see the fear that kind of promoting human welfare and global public goods might lose in the future? Or do you actually think that stronger governance clusters on that? Because sometimes I really do feel that we are going in the wrong direction, that we do get some really strong clusters, governance clusters, internationally that do undermine the promotion of human welfare and health.
So I think the heart of your question is the world going to get better or worse?
Yes.
Which is a really difficult one. And I'm going to answer it very briefly because it's an impossible question. I'm an optimist and I believe it's going to get better. I actually I think that we need to work to create the right governance arrangements and structures at the global level that will move us there, and maybe rely on the next generation of leaders to help to move us there. So this is my kind of cop-out your question. There are plenty of people who would disagree with me. But if we look at, in fact, the long arc of history, right? And there's a great new book out, actually, called The Better Angels of Our Nature. Has anybody heard of this book? By a historian and psychologist at Harvard named Steven Pinker. He released a book, it was about a year ago, he published it, called The Better Angels of Our Nature. And he looks over the entire recorded record, I mean the written record of human history, and he finds that, in fact, violence has declined. Antisocial behavior has declined. Of course, we're suffering from many, many intractable social problems, but poverty has declined, violence has declined, and there might be little, not little, but sort of spikes in history, of course. I mean, World War II, for example, the wars of the last decade, but the level of interstate conflict has declined. And so if we think about the and how do we get here, what is it about global governance arrangements over the last 50 years that have helped us get here? I think it's important to kind of keep the bigger picture in mind. And I'm reminded of, I said I'd give a short answer, but now you've got me going. I'm reminded of a picture that a colleague of mine uses when he talks about global governance. And he said in, I think it was 1884, does anybody know what the Conference of Berlin was? I believe it was 1884, 1886. Conference of Berlin.
It was when they drew the map of Africa. That one, yes.
Sorry?
The one where they drew the map of Africa, you had some.
Yes.
some stakeholders in some states and some people.
Right. So you had sitting around a table men. It was all men, primarily from the colonial powers from Europe, and they took a map of Africa and a number of nation states. And what my colleague Gorik says is, this is what global governance looked like in 1884. Fast forward to where we are today. Of course, this is completely unacceptable. The world could not function this way. The norms regarding what is the proper behavior of one citizen of the world to another, one state towards another, what are the relationships that we should have with each other, have completely changed. And I think, in my view, they've changed for the better. So yes, the UN system is insufficient for meeting current global challenges. I would say that on the record. But has it contributed to making the world a better place in the last 70 years? Absolutely, no question. So let's see what all of you can build in the decades to come. Let me leave it as a challenge. Yes.
Yeah. When you brought the basic international relations theories, when I was looking at the speaking about back in more so in the past, you had stronger military powers kind of dominating and economic powers. I feel like with some of these free trade agreements, for instance, we've seen a shift back over to that sort of theory, where it's not necessarily a single countries, but those single countries are creating coalitions because they have strong economic powers. Like with the TPP, for instance, the United States is trying to box out China in the Asia Pacific and retain its economic dominance by getting everybody else in the region. And those agreements seem to be undermining the global governance system as a whole, like WTO, WHO, of making countries kind of sacrifice intellectual property and public health as a public health good to be protected. So in context of that, I'm seeing more and more of these FTA on a daily basis. How do you see the WHO, WTO, those UN systems being able to kind of not necessarily compete with that, but be able to have its norms matter at all?
Okay, so I think, and to encapsulate the issues that you raised, you're talking about the fact that we have built a number of multilateral institutions to which almost all countries are members, systems of global governance we could call them, but they're being undermined particularly by either regional groupings who want to carry out negotiations outside the multilateral arena, or sometimes bilateral agreements. So I think it's an excellent question, and it's one that I know the Director General of the WTO is losing sleep over night and day. Right? Is the WTO no longer relevant because states have given up on the possibility that you can reach agreement in the WTO? I think, just keeping an eye on the time, let me offer a couple thoughts on that, but it's also a much longer conversation. 3 thoughts actually. One, when I put the slide on, oops, we're going to run out of time, on basic international relations theory, I think the ways in which you can make use of these ideas to help you understand the world is to think of all 3 operating at once. So I would never want to say that these things don't matter. They absolutely matter. They absolutely still can drive global politics in many ways. But when I raise these 2, does the WTO matter? Can it exert a force of its own? I would argue yes. Are there other roles at play? And when we think about the WTO, while it's nervous that many key trade negotiations are happening outside the arena, many countries pursue them with an eye towards bringing the WTO in later years. And in fact, the pursuit of bilateral and regional agreements has never been completely taken off the burner. There's always been this sort of interaction between the 2. So I don't think we're necessarily moving away from an embrace of multilateral systems, but that we shouldn't put all of our hopes. I mean, that's maybe the 3rd major point I would like to make. That there have to be other governance arrangements, and not only all multilateral governmental decisions that are used. But the WTO, I mean, in many ways, the rules that it has set up still have a tremendous force around the world, for good or for bad, for public health. And those of you who are interested in access to medicines, I think, are familiar with what some of those are. But it's a much longer conversation. I'm happy to chat offline about that in more detail, but it's a great question. Let me shift gears a bit and move into the key challenges, because I think this is hopefully going to help you grapple with the case study that we should move into relatively soon, because I see it's now 10 in the morning. Okay, so we've talked a little bit about globalization, what is global governance, and I think what I'd like to do is introduce some ideas and really consider this just a brief introduction on why is it that global governance can for health. What is difficult or challenging about the current ways in which global governance processes work and their impacts on health? So first, we need to understand, of course, the global context. And we know that we live in a world of huge inequality. We live in a world where there are tremendous unmet health needs. We live in a world where different powerful actors, whether they're countries or companies or experts, can often act in ways that are negative for the health of individuals or societies. That's the global context in which we work. So I'm not going to get too much into that global context. But of course, the world is a far from perfect place. What is it about the structure of the global system that we have today that makes it difficult to respond to some of these unmet needs? There are three major types that we think are some of the most important. There are many, many types of challenges, but these are the ones that we've identified as being some of the most important. And there's an article that was actually just published today in the New England Journal outlining, in fact, most of what I'm talking about today. So you can refer to that for a summary. So the first is this notion of the sovereignty challenge. Let me go. Yeah. Okay. And the notion of the sovereignty challenge is that we live in a world of nation states, 193 within the UN, anyways, more than 200 by others' count. And each of those nation states is sovereign, meaning no other nation state officially has the right to, in fact, in what's going on within another nation state. It has hierarchical power over the other, formally in the system. So within the UN, for example, every nation state has one vote. One state, one vote. It doesn't matter if you have a population of 1 billion people or a population of 300,000 people, you have the same power as equivalent or equal sovereign nation states in the system. That's the way the global system is constructed. However, we know that health threats don't really respect borders. We know that single nation states are not able to respond. And yet, we don't have strong institutions for pooling sovereignty, for example, or for sharing sovereignty. We have a few, and the European Union is one example of that. But even within the European Union, as I was mentioning before, this institution of sovereignty is still there. So how do you organize actors, whether states, sovereign states, or non-state actors, together without a global authority? That's what I was referring to earlier. This is a fundamental challenge. And the key examples, and the ones we'll go through in just a minute, is that in 2009, when the H1N1 flu pandemic hit, there was a shortage of global vaccines, and the distribution was skewed. There were not enough vaccines to go around for what was essentially a worldwide pandemic, and that it was only a few wealthy countries that actually had access to most of those vaccines. And because of the institution of sovereignty, we didn't have any effective arrangements at the global level to share those vaccines, to make sure they reached the most vulnerable people or those most at risk of getting the flu, or that there was even some kind of equity in the way they were distributed. We had the WHO, and we'll get into this in just a few minutes, but we didn't have really effective arrangements. In many nation states, I'm not saying all, but in many nation states, that is partly the job of the national government. In the United States, outbreak in California and all the vaccines were sitting in New York, you can bet that the federal government in Washington will not allow New York State to keep all of the vaccines and prevent them from going to California, because the federal government is responsible for the entire country. We don't have anything like that at the global level. So what ends up happening? All of the vaccines can essentially stay in New York, even if the need, the risk, the threat is sitting somewhere else in the country, or in this case, in the world. That's really the heart of the sovereignty challenge. Okay. The second type of challenge is what we call the sectoral challenge. And this relates very closely to the notion of social determinants of health. That the health sector, or in our case the global health system, is primarily responsible for health, but health is increasingly affected by decision-making outside the health sector. We heard about the importance of negotiations, particularly around intellectual property. These connect on health, but health actors don't quite know how to engage oftentimes on trade negotiations. This is just one example. It's very difficult to cross over between different sectors. And I hope that all of you, as future health professionals, will in fact not be discouraged from engaging in some of these policy-making processes that are happening outside of the health sector, because these things at the end of the day might be the forces that have the biggest impact on the health of your patients. As much as we wish it was a one-on-one doctor-to-patient relationship, we know in reality that it's not only society and broad social determinants that can have an impact on somebody's health, but in fact global governance processes at the end of the day can determine, for example, whether somebody has an affordable medicine or not. So we as a health community need to learn how to engage with all of the other policy-making arenas, whether it's military and security, et cetera, et cetera. Okay. The third challenge, and this one is, I think, the most difficult to really grasp. The third challenge is called the accountability challenge. And here, there's two types of accountability problems. One has to do with the notion that we rely so heavily on national governments to be the main actors responsible at the global level for not only responsible, but who represent the interests of their populations at the global level. But we know that national governments don't always do that. We know that national governments sometimes, in fact, violate the rights of their own people, or they do not actually represent, in a fair way, the views of, for example, minority groups within a country. So if the entire system of global governance sits so heavily on the legitimacy of national governments, but those national governments are, in fact, not democratically elected or not legitimate, then you have major accountability problems in the global governance system. The second type of accountability challenge has to do with non-state actors, so non-governmental actors. I'm talking about big organizations like the Gates Foundation, or the big NGOs such as Doctors Without, or multinational corporations such as the tobacco industry. These are all non-state, transnational actors, very powerful, very well-resourced. Oftentimes, we have very few accountability mechanisms for these types of actors. As I was mentioning earlier, the global system is so heavily structured on the state-based system that we have not yet come up with great ways of governing the behavior of these other types of actors to make sure that what they're doing takes health into account. And we'll see, I think, all three of these challenges coming up in the flu case. I think in the interest of time, let me pause there and offer just a quick summary of what I think are the two compelling questions in the field of global governance, and then we'll take a quick stretch break and move into flu. So I think there's really two types of questions that we should be interested in. And the first is an empirical question. How does global governance actually function today? What governance behavior of various actors or not? States, multinational corporations, civil society groups, et cetera, who are operating in what I call the global public domain, which is really just the global sphere. So how does it work? And because the world is changing so quickly, we have lots of competing theories and experiences and views on this. Nobody really actually has the perfect answer of how it works or how do you predict outcomes. This is an area that's rich for further research and study. The second, which I think is of equal importance, is more of a normative or policy question. Is how can health-related global governance processes and outcomes be improved, and for what purposes? And this is really a charge, I think, on all of you. We need to first understand, of course, how these processes work, but then we need to also be smart and dedicated in pushing for the better arrangements that will actually lead to better individual and population health at the end of the day. And again, the jury is out. There is no clear or black and white answer regarding how do you actually change some of the global structures or processes to get better outcomes for health. So these are enduring questions. I think they're questions that will not necessarily be answered over the next 5 or 10 years, so there's plenty of time for all of you, or 30 years. But I'll be interested and engaged in these questions as you move forward in your studies. Okay. Let me skip through some of these. Let's take a brief stretch break and then come back and talk about something much more concrete, which is vaccine supply for pandemic. So let's say 5 minutes.
Jeg skal være. Jeg tror, der er her. Der var i hvert fald hernede for enden, og ellers så
I mean, it's really important to bring some of the
So like this project on the conference how into the biomedical. Yeah. I think for them it's really
I was debating actually if we should start with this. It's hard to delve into this.
Yeah, no, I think introduction is good enough.
That's okay.
Yeah, that's amazing. Yeah. So because we realized 3 days ago, but most of what we're doing is what we're doing is very academic. What we're going to do is
Ja.
kode til nettet hernede. Fedt. Hun har modtaget, hun har en eller anden mail. Jeg så ikke, hun om det, altså, det ligner ting, hun har modtaget sådan en shirt eller faktisk. Så se, hvad vi kan fikse. Og gøre det hver dag også. Altså det er jo godt, når det kan sige igen. Ja, ja. Jeg ved ikke, hvordan jeg regner Jeg er mega træt. Ja. Dejligt. Ja. Jeg tror, det er næsten en god bil, den har været så. Merci. Okay. We should get started. It's difficult to respond to these like very sophisticated questions.
It was really, it's like in Taiwan situation. Also, we're working very hard.
Det er der, den film, vi skal være, som de har lavet i Indien. Den har de lavet. Jeg har set den på 2 år. Det var, at den skulle lige rettes lidt til, så det der, den skulle være, så vidt jeg var.
Ja, men det som
det her bliver sponset, så kan man skrive sign ind her, så kan man sponsor. Hvorfor er mit efternavn? Der kan vi her rette til det også. Burde jeres tur også være på.
That's why this particular initiative pieces of string. I don't know how familiar you are with academic structure. It's a strange for example, the other issue that we work on is urbanization. How do you design cities, not design, manage cities? It's a cool place.
Yeah.
You're studying in Taiwan?
Yes.
I've never been to Taiwan, but I've seen photos. My friend is
yeah, it's nice. I love fish foods actually. The food outside is not very, the restaurants are not very expensive. Personally, I was also very interested in the personally, I would like to have a chance to do some internship for a while. I'm also very interested in
we don't do any kind of medical
good. I mean, with another 15 delegates.
Okay, let's get started.
Yes.
Let's get started.
Ja, den der jeg er bange over den. Jeg tager med kaffe, det koster rigtig. Der skal altid noget her i billedet af kaffedrikker. Virker det.
Okay, I'm going to begin presenting briefly the case study that some of you received in advance and were able to read. So for those who haven't had a chance to do that, I apologize, I'm going to go quite quickly, but I think you'll get the gist, the key features of the case. And then what I hope we'll have time to do is break into small groups, at least for, it looks like it's only going to be about 15 minutes, but so you have a chance to discuss amongst yourselves. As I'm going through the case, keep in mind, how do you solve this problem? And try to come up in your recommendation how you would manage this problem better in the future. Okay. So this case is about ensuring vaccine supply for the next pandemic. And the question is, will the world be ready? Probably not. That's the short answer. Okay, so in September 2010, the Director General of the World Health Organization, Margaret Chan, said this. She said, vaccine supplies would have been too little, too late, with large parts of the developing world left almost entirely unprotected. So what was she referring to? We know that pandemic influenza can be a dangerous and deadly pandemic, and the last great pandemic was actually 1918, 1919, with an estimated 40 to 100 million deaths worldwide. A huge number in terms of total number of deaths on the same scale as HIV. And this all happened within a two-year period. There have been in that period a number of outbreaks of potentially pandemic flu, and there's two that are very important, I think, to mention here. The first is H5N1, which is often called avian flu, which was first detected in Hong Kong in 1997. And the second is H1N1, which is, of course, often called swine flu or pig flu, which first was detected in 2009 in Mexico. The key difference between these two pandemics is, of course, that H5N1 avian flu was both severe, but it spread very slowly. H1N1, on the other hand, spread very quickly and was mild. What everybody is concerned about is what happens if the virus spreads very quickly. We will be in deep trouble. Okay, so just a quick picture of the spread of H5N1, both through animals as well as through humans, and then the spread of H1N1, which I think within 8 months had spread to over 200 countries, essentially all countries in the world. Okay, what makes the virus difficult to control? Why is this such a difficult challenge? So one of the reasons is because of what we call reservoirs, that the virus can live in a number of different types of species of animals. So it's difficult to, it's impossible, in fact, to eradicate, and difficult to predict when a virus will make a leap, for example, from an animal to a human. You also have the risk that the virus will mutate. That inside an animal, it can mutate and then become much more dangerous, or mutate to spread much more quickly. And we don't know when that will happen. So there are a lot of things that we don't know. It's a situation filled with lots of uncertainty. We don't know how severe or how transmissible a new flu virus will be. We don't know what the human immune system will do, how well human beings will be able to respond. We don't know if the drugs that we have can treat the flu once people get it. And of course, we cannot develop a vaccine until after the outbreak begins, because to develop a vaccine, you need the virus sample. It takes time to develop the vaccine, it takes time to produce the vaccine, and of course we don't know if people even want to get vaccinated, because as many of you may know, sometimes people don't want to take on the risks associated with vaccination. They would rather take the risk of getting sick. I'm not going to spend while we do have a couple drugs that have been proven to be effective against some strains of flu, it's generally not considered to be the preferred intervention. So let me move, and this is why we're shifting the focus to vaccines. Now, let me just say briefly, the case and the purpose of this case is not to get into technical debates about how many drugs do we need, how many vaccines do we need, what other public health measures. It's really not about that, but it's really to illustrate some of the global governance challenges. So just for the purposes of the learning here, just assume that we need to use vaccines for at least part of the response to the next flu pandemic. Okay. So as I mentioned before, we will not know the efficacy of existing vaccines until the pandemic actually emerges, because you need the virus sample. The time lag is 4 to 6 months to produce at scale. For H5N1, it took about 5 months to produce the vaccine. We don't know how fast we can actually produce the vaccine within eggs, because most vaccine production facilities still actually use chicken eggs. Global production capacity is limited, so we have a global population of now about 7 billion people. But in fact, if we want to achieve enough vaccines to achieve production by everyone, between 1.5 to 4 years to in fact produce enough. And that's assuming that we get very rapid production and assuming that someone will pay for vaccines for everybody. Finally, and this is very important, production capacity is concentrated in 6 major firms based in even smaller number of high-income countries. So you don't have flu vaccine producers everywhere in the world. They tend to be quite concentrated. As I mentioned, we're still using old production technology, chicken eggs. There is some new technology that's under development, and this is an important factor to think about. Are there ways in which we can invest in faster development? But still, we're going to be stuck with some sort of time limits on production capacity. So here's one of the big questions that I would like to put forward to you is this question of global access. What happened in the H1N1 outbreak in 2009 was that countries, specifically developing countries, went to WHO and they said, we need access to at least some vaccine supply. Can you please help us manage this problem? And the high-income countries and some vaccine manufacturers agreed, okay, we'll donate some vaccines to WHO and that will help to address the problem. Sounds great, right? WHO received a total of, a commitment, I should say, of 0.2 billion doses, so 200 million doses, to cover 95 countries, 95 developing countries. By the time the pandemic had been running for about 7 months, only 2 countries had received any of this supply, which is insufficient. By the time the pandemic was in August 2010, only 65 countries had received any doses, and that was actually only 60 million. So this was less than 1/3 of the 200 million that had been committed to WHO. On top of that, we had other production and supply issues. So for example, in Australia, Australia is home to one of the few vaccine manufacturers in the world called CSL. An order from the US government, because there was a huge panic in 2009. The Australian government said, I don't care about the contract you have with Washington, you supply Australia first, because we need to protect our own people first. And there were similar discussions with the GlaxoSmithKline factory in Canada. And of course, this is a classic example of sovereignty at work, right? It doesn't matter at the end of the day what type of agreement is made between a firm supply. At the end of the day, if the Australian government says, you know, you supply us first, and we will do whatever it takes to make sure that those vaccines stay within our territory, that's the end of the story, more or less. So this is a clear example of sovereignty at work, regardless of whether most of the risk or threat was sitting in these two countries. That's where the factories sat. The other issue came up around Indonesia and H5N1 samples, so the avian flu samples. Back in 2007, I think it was, the Indonesian government announced that it was not going to share its virus samples with the international community anymore. And that's because it felt that it could not afford the vaccines that companies were producing using those samples. Why should the government cause more panic, particularly among the high-income countries and the vaccine manufacturers who rely on a global system of virus sharing to develop vaccines. Indonesia actually quickly changed its position and agreed to share the virus again, so this is a little-known fact, but it launched a new process of international negotiations around virus sharing as a result. I won't get into that into too much detail. But let me just say that without the virus sample, there's very little you can do. You absolutely need access to this physical material in order to track the virus and to develop interventions against it. Okay. In addition, so who are exerting sovereignty in different ways. By keeping the vaccines within their borders or keeping virus samples within their borders. You also have, of course, the pharmaceutical industry, which in some cases sees this as a great opportunity. I thought this was a lovely headline from the British newspaper. This is the Mail and Guardian, I think, or the Daily Mail. A British newspaper, I think. In any case, swine flu fears help Glaxo bring home the bacon. So there's a huge potential profit for the pharmaceutical industry because everybody is panicking in 2009 for access to flu vaccine. Governments place huge orders. And in 2009, these are the amounts that a few firms were expected to bring in from flu vaccine sales alone. However, there's a lot of risk in the industry. For example, when it turned out that H1N1 of France, which had been one of the biggest purchasers of vaccines, they used only 10% of the doses they ordered for their population of 60 million people. And they wanted to then cancel their orders or in fact return some of the vaccines that they didn't need. And so the pharmaceutical industry was quite upset over this because they said, you ask us to ramp up production and then you change your mind, and that's not really going to work as a sustainable system in the future. So there's a lot of work here, and somebody needs to put money on the table, essentially. I'm going through this very quickly to give you time to discuss. Okay, so moving on to governments, we talked about the pharmaceutical industry. Let's talk for just a minute about WHO. WHO played an extremely important role in the global response to this pandemic, one of which was tracking information and issuing different levels of warnings about how severe or rapid the pandemic was. And it also negotiated this supply of commitment to 2 billion vaccines. There were accusations launched against WHO after the fact that it had not behaved properly. So these are two quotes from an investigation launched by the Council of Europe. One, the Assembly regrets that WHO has not moved swiftly to revise or reevaluate its position on the pandemic, and the real health risks involved, despite the overwhelming evidence that the seriousness of the pandemic was vastly overrated by WHO at the outset. So WHO is being accused of overhyping the pandemic. Second, the main concerns regarding the current H1N1 influenza include the proportionality of the response given to the public health threat, the transparency of relevant decision making, including the possibility of undue influence by the pharmaceutical industry. Okay. It was also as a result of this. So here's what I'd like you to think about as you move very quickly into discussion groups. is the role of all of these different actors working within what one might call the global health system, trying to protect either the health of their own population, trying to keep their businesses running in a healthy way, trying to act as WHO is tasked to do as, in fact, the sort of information clearinghouse and the global arbiter in a way in a pandemic response. So what WHO just doing? Did it use the evidence, considering there was a lot of uncertainty? Was it actually panic mongering? And for those of you who are not non-native speakers, basically overhyping and creating panic. Was it improperly influenced by industry? Secondly, was industry being greedy or fear-mongering, again, to boost its profits? Was Indonesia being irresponsible, or was its decision to withhold vaccine to try to get more benefits for its own population justified? And you could say the same about Australia or Canada when it came to holding vaccine supply. Were northern governments panic-stricken, or what one might call vaccine hogs? What ended up happening was that the majority of the limited supply of H1N1 vaccine was quickly ordered primarily by governments in the north. Even developing money to put on vaccine, the supply was locked up very quickly. So there were shortages. Okay. So here is actually the full quote from the DG. And this is, again, as the pandemic is winding down. And she concludes, this time around, we have been aided by pure good luck. The virus did not mutate during the pandemic to a more lethal form. Widespread resistance to oseltamivir, the drug, did not develop. The vaccine proved to be a good match with circulating viruses and showed an excellent safety profile. But had things gone wrong in any of these areas, we would be in a very different situation today. Had the virus turned more lethal, we would be under scrutiny for having failed to protect large numbers of people. So the conclusion is we dodged a bullet. And if any of these things had gone wrong, we would be in a situation today. So the question that I would like for all of you to discuss, this is a bit more complex than we have time for, in your small groups, we're going to count off from 1 to 7, is what can be done in the future? What can be done to better manage this type of problem, considering it's quite likely we will have a flu pandemic in the future? How do we ensure better vaccine production and equity in this? Okay. So let's number off from here, going from 1 through 6, 7, 1 through 7. Okay. 1, 2, 3, 4, 5, 6, 7. Oh, 1. No, I'm 7, sorry. 1, 2, 3, 4, 5, 6, 7. Okay. 1, 2. Sorry. 5. 6, 7. 1, 2, 3, 4, 5, 6, 7. 1, 2, 4. Yeah, 3 and 4. Okay, so find your groups. Come back in 15 minutes. We'll hear quickly from all the groups what your big idea is, and then we'll conclude. Sorry, it's such a short period of time. 7. 1. Okay.
My group is